It's March and it's Colorectal Cancer Awareness Month. 3 men are here, so perhaps they're best placed to talk a little bit about this. We're joined this morning by Dr. Avenello Maynard, who is a consultant gastroenterologist. Good morning to you, sir.
Good morning. Thank you
for having me here. You're welcome. Dr. Greg Padmore is right next to him, the little one in the middle. And he is a Pancreatic Surgeon Surgical Oncologist as well, among other things.
Thank you.
Good to have you, sir. And Dr. Shabir St. Did I say that right?
Yes.
Close enough.
Yes.
Good to have you as well. What is colorectal cancer?
So essentially it's cancer in your colon or in your rectum. It develops usually due to a polyp, which is a lesion that develops in your colon, and over a period of time then it forms to cancer. It's unfortunately the second most common cancer in the world. And if you look at Barbados numbers, we're about third overall in terms of cancers, but second in terms of cancer death. So it's actually something that affects a lot of us here in Barbados and in the Caribbean.
When you say third and second, who we're compared with?
The world, worldwide.
The world?
Right.
Barbados?
Correct. Well, no, not the world, in terms of when it's the second cause of cancer death. In the if you look at the region, we are probably third in terms of the Caribbean and Latin America in terms of in terms of incidents.
So what causes this to happen? What causes the prevalence of these polyps?
So what we know about the disease, that there are risk factors for it, what we call modifiable risk factors and non-modifiable risk factors. The non-modifiable ones are things that we can't change about ourselves. So age greater than 45 is a risk factor for colorectal cancer. Your family history of colorectal cancer, or even if you have polyps in your family, is an important factor for that. There's genetics in it, but that plays a very small role in it. And then when we talk about the modifiable ones, essentially it's diet and your habits. Diet plays a huge role in terms of this being a problem. And your habits in terms of if you drink, if you smoke, if you have a sedentary lifestyle, and your diet is, again, a huge role in terms of this type of cancer being prevalent here in Barbados.
How would I know that I have a problem?
So you don't want to know if you have a problem, because if you develop symptoms, that's an issue. So what we're trying to do, coming on TV, is to have people be preemptive to screen for these types of illnesses. There's really no symptom of colorectal cancer. They're what we call alarm symptoms, which doesn't say you have cancer. It just says that something is going on. So if you're bleeding when you go to the bathroom, you have anemia, your bowel habits are changing, those are things that you should really go and address with your physician. And then they will have us take a look and see what's going on. But what we're trying to push is for somebody that doesn't have any symptoms, come and see us so we can prevent this problem.
Prevention is always better than cure, but
Correct.
We're stumbling upon it, Dr. Greg.
Correct.
And so here it is, we have now these polyps.
Yep.
Is this where you come in?
Well, as the polyps, once detected early, can be removed at colonoscopy. What that is a test to go in the colon with a camera, and you can remove them with like a little sneer, and pretty much removal of the polyp stops the trajectory of cancer in that spot. Where surgeons come in is more so if the polyp has developed into a cancer, or if it's too large for removal. At endoscopy is what we call it, at colonoscopy.
That's where you come in now, Dr. Shabir.
Yes.
So, the treatment options.
Right. So the treatment options are based on the stage of the cancer, and unfortunately 70% of patients who are diagnosed with colorectal cancer in Barbados, it is already beyond the lining of the bowel. And so even when I come in and I remove it, more often than not, they are going to require chemotherapy, radiation if it's in the rectum, and even then, 20% of patients have what we call stage 4 disease, so widespread disease, and so a significant proportion of them do not survive more than 3 years. So yes, I can come in, and if it is early, you can have 9 out of 10 people will have a normal life going forward. And so we can operate on them. They can be home within 3-4 days, and they can do well. But what we want is we want people to screen so that we pick them up at polyps or, God forbid, very early cancers, and it doesn't affect their quality of life and their length of life.
What's screening like?
So there are a number of different modalities to screen, other different ways that go from the invasive to the non-invasive. So we can do stool tests to see if there's what we call a cut blood that will tell if there's a problem. Again, it doesn't tell you you have cancer. It just tells you, you need to do something as a colonoscopy, for example. We can do imaging tests for people that are probably not good candidates off the bat or even choose to have that, where you get a virtual CT done of your colon that colors up the colon and tells if there are polyps there, for example. What we call the gold standard, the best test is colonoscopy, which is what something a gastroenterologist or a surgeon that deals with colon would do, which is an invasive study, but nowadays is an extremely safe study where we are able to put you to sleep, and with a long tube that has a camera at the end of it, we're able to look at all your colon. You're asleep, you're not going to feel anything, there's no discomfort, and the good thing about that test is we're able to look, we're able to take out any polyp that's there, or we're able to identify if there's any problem, and then at that point in time, we can always speak to our surgeons if something has to be done.
Is it advisable that, let's phrase it this way. At what age is it advisable for people to start being screened for
So for average risk, which is probably everybody here in this room, 45 is the new 50.
45
Yeah.
is the new 50.
So before it was 50, correct. Before it was 50, but now it's dropped to 45 because we're seeing this really high increase in the rate of colorectal cancer in young people.
Really?
Yes. It's expected to rise in 2030 to almost 124% in young people, which is significant, and that means that the guidelines now have decided that we need to drop the age of screening for these patients. So if that's if you're at that stage, you need to do some type of screening, whether it is the stool test or a colonoscopy.
Can one confuse a colon cancer with pancreatic cancer, for instance, or there's no correlation at all?
Yeah, kind of as separate organs. So for colon, typically changes in your bowel habits,
right,
blood in the stool, completely different locations. Pancreatic cancer, which is pretty silent for most patients, so definitely different symptomatology, but again, we want to catch any problems before symptoms arise.
The whole idea is to be screened.
Exactly.
As early as possible, because
Yeah.
45 is the new 50.
Yeah.
So be screened from much younger, indeed, fellas. And do you find a lot of women presenting with colon cancer?
Yes. So for in terms of cancers, it's prostate, then colon for men, and then breast, then colon for women.
Ooh.
So the problem is that people focus on breast and pancreas,
prostate.
and everyone has a colon, and some people don't realize that. So we've gone into the community, we've been going into churches, clubs, and speaking about screening, and you'd be surprised how many people don't believe that they have a colon. They don't understand what it does, so we try to educate people on that and the importance of screening.
So what does the colon do?
So the colon absorbs water and gets rid of waste or byproducts of digestion, and that's the main role of its function.
So it's like a filter of some
Yes,
sort.
and so we can remove a portion of it with the cancer, and you live a completely normal life. Your bowel habits may change a little bit, so instead of having one bowel movement or two, you might have 3 or 4, depending, but you can adjust that with your diet. But that's not a good reason to not look at it and to get it screened.
Can I live without a colon?
Yes, you can, absolutely.
Oh, so take it, go. Some people probably tell you that, right?
Some very rarely do, but there is risk associated with surgery.
Right.
Yes, and the less colon you have, the less water absorption happens at that stage. And so there are some changes that happen that we only take what absolutely needs to go in that situation. And we would love to never have to remove another colon again, So that's why we're here talking about screening, trying to get people aware of this problem.
Dr. Avenello, what are you doing this month of March to heighten the awareness and that clarion call for people to be screened?
Well, things like this, talking on TV when we can. There are a number of events that have been planned for this month in terms of community church events that we're doing as well. There's going to be a fun walk that is planned for the end of the month. A football match is also planned at the end of the month. You can just search social media and you can see the whole planning of those events. The hospital is also doing a number of talks, open house, so that you can come and take a look at the equipment, have an idea of what it is, and speak to general healthcare workers as to any fears that you may have about the procedure, about your risks. But it's just colorectal cancer screen, and you can get all that information online now.
Dr. Shabir, so how I cringed when you mentioned that device.
Right. So in just taking the public system, QEH, for example, Dr. Maynard will do colonoscopies twice a week. We have another colleague who does twice a week. I do once a week, and we will do, let's say, average 10 a day. And it's a very safe procedure. To date, we've not had any major complications or lost any patients. So it's a very safe procedure. I have encouraged, both of my parents, for example, have had it. I encourage anyone to get it. As you said, he said 45 is the new 50. I expect that
I've had it.
it's going to be, exactly, 40 is going to be the new 45 soon with the way the trends are going. And so we want everyone to understand it's a very, very safe procedure to undergo. And that it is being done in the hospital, but also outside, very safely every day. So I just want to encourage people not to be afraid. And then the last thing is, as Dr. Maynard said, just because you have a positive stool test does not mean that you have cancer. Some people get very alarmed, they get very worried that the test was positive. There are other things like as simple as hemorrhoids that can flag the test positive, but it is just a way to then move on to the colonoscopy. And so I just want everybody to understand that. And if you do the stool blood test, you cannot do it as a one-off. You have to do it every year. Every year. Every year.
And if I can, just in terms of the whole risk, I think you need to put things in perspective. The way the accidents are happening in Barbados, you have a higher risk of getting in a car accident in Barbados than you have of having a complication because of a colonoscopy, right? In the media, we're hearing all this gun violence, and so you can understand the context of this disease. 2022, we've had more colorectal cancer deaths than we've had for the last 3 years of gun violence death. And that's impactful. That's a number that we cannot sustain, especially knowing that this is a disease that is very slow. And as Greg said, if we take out these polyps, you're not going to develop this disease. You're not going to develop this problem, right? We can prevent this problem and decrease our numbers, because unfortunately Barbados has very high numbers and very high mortality, because we're seeing patients, like Shabir said, with advanced disease that could have been prevented. And unfortunately, you mentioned women. Women are more likely to get this test done because they're accustomed to getting stuff done, and men will not. And that's why we see prostate cancer as being number one, because we don't get screened for that. That's why we see colorectal cancer being number two, because again, we don't get screened for that.
The area.
Correct.
And for a lot of men, there's a sensitivity around
this
the area.
idea of, correct, of, and then when you go to surgery, I'm not a surgeon. He will tell you the stuff that they will do to you is a lot more invasive than a colon.
Invasive and expensive.
Correct.
In terms of the equipment.
Yes.
So it's definitely prevention is better than cure, more economical, and everything for your life, your quality of life, and your ability to contribute to Barbados.
So without a doubt, it is important this month of March and every month thereafter to be screened for colon, get a colorectal screening done. And that helps you to be assured that you can live a longer life, or that you'll be all right. But if you're not going to be all right, there's something that can be done about it indeed. And these three gentlemen are well poised to be able to do something about those results. So gentlemen and women, piece of cake. I noticed that 2 hands went up to say, yes, I've had the colonoscopy, but one didn't. Am I right?
Yeah, based on age.
I like that. Based on age.
So now we know we'll expect you with one screener test and another.
Work on him.
We're working on him too. But
good. So and most of our crew who are here,
yes,
gentlemen, we all have to be screened for, I have a colorectal screening done. Gentlemen, thank you so much.
Thank you very much.
Dr. Avenello, Dr. Greg, and Dr. Shabir.
Yes, sir.
Shabir,
yes.
Indeed. Thank you all. Indeed, on our screen, Dr. Lord is saying, what about you if you have a family history of colon cancer? What about if you do have a family history?
Yeah, so that does increase your risk for colorectal cancer. You probably, not all history is the same. So you really need to speak to your physician to judge if you need to get screened at an earlier age, for example, rather than 45. Some people have to get done at 40, even 30 years old. But again, you need to have that conversation with your physician, your healthcare physician, and they will explain to you what's the best way of doing it, what age to start at, and how to do it.
All right. Well poised to be able to answer your questions. Thank you, gentlemen.
Thank you.
Thank you very much.
All right, you're welcome.
Morning, morning, morning.